Many people in today's society are aware of what Botox is mainly used for, but are not aware of how the toxins are widely used off-label to treat medical conditions such as migraine, hyperhidrosis, certain eye conditions, muscle stiffness, and even overactive urinary bladder. These are just a few of the many medical conditions that Botox can be used for. A person with these conditions are not always aware of the options and sometimes are surprised when a physician recommends Botox. One of the main medical conditions Botox is used for is hyperhidrosis, excessive sweating. People diagnosed with hyperhidrosis have a larger sweat glands that sweating is unpredictable. Excessive sweating can occur on more than one area, palms, feet, underarms. According to the International Hyperhidrosis Society, there is no rhyme or reason why these symptoms occur. In most cases, no cause can be found. Doctors typically prescribe topical antiperspirants, for example, Drysol, and oral medications like Robenol to reduce sweating. If topical and oral medications are not controlling the sweat glands, usually patients are able to decide to have sweat glands removed surgically or have Botox injected to underarms, hands, or feet. According to International Hyperhidrosis Society, Botox blocks the secretion of the chemical that is responsible for turning on the body's sweat glands. Studies have shown 82 to 87% decrease in sweating. Another medical condition that Botox is well known for are eye conditions. One of the conditions is strabismus, or otherwise known as crossed eye. The other condition is a rare disorder called blepharopasm, which is uncontrolled blinking in the eyes. The Botox works in the way that it stops the stiffness in the eye muscles or eyelids causing the disorders. Although these are not permanent fixes for the medical conditions, according to WebMD, after a few months, a person would have to reapply the Botox injections. But in most cases, and people with this condition usually do not mind because that disorder is considered extremely bothersome to most. Other elements Botox is used for people with overactive urinary bladder dysfunction. Bladder dysfunction causes the need to urinate and even involuntary loss of urine. According to the WebMD, overactive bladder affects many women, mainly over the age of 40. Botox is an option for the condition, and studies from Botox have shown about 45 to 55% of patients' conditions completely resolved, and results have lasted for 24 weeks. We have learned today that Botox is a perfect form of botulinum toxin A, known best for treating fine lines and wrinkles, but it is also used for medical purposes such as hyperhidrosis, specific eye conditions, and overactive urinary bladder dysfunction. Even though Botox needs to be repeated and does not completely cure these conditions, the quality of a person's life improves in numerous ways. They won't feel embarrassed or a need to limit social life and work. A person will feel better inside and out and feel more comfortable in their own skin.
Good. Thank you.